Hi, Dr. Ford here with an update on our medevac'd eagle. If you haven't seen it yet, watch my YouTube video titled Eagle Medevac that was posted November 20th, 2011. The eagle rested overnight, and we performed surgery the next morning to remove the necrotic tip of her left wing. Dr. Jim Little, owner of All Creatures Animal Hospital in Bremerton, Washington, allows us to use a surgery suite for wildlife. My wife Susan is a licensed veterinary technician and a good avian anesthetist. I can relax about anesthesia while she's on the job. Here you can see her recording the eagle's vital signs. We monitor heart rate, breathing rate, and anesthetic depth. This eagle has an endotracheal tube in place so we can breathe for her if necessary. She also has an intraosseous catheter so we can deliver intravenous antibiotics and fluids during surgery. So there's a bone sticking out right here. It's one of the finger bones. And then this is the attachment site for the primaries, which are the powering feathers for flight. And so we're going to be losing, it looks like we've already lost, I think one or two of the outer primaries here. We'll lose a few more, so the bird won't be able to fly. And if I don't do surgery, then this will eventually kind of slough off, but there won't be any more flighted, so you know, this will heal up a lot faster and more comfortably if I just debride it and amputate it.
Okay.
That's too bad. It's pretty close to keeping its wingtip, but not quite. The wingtip is prepared for surgery by removing or covering feathers near to the surgery site, cleansing with an antiseptic soap, and positioning the wingtip for easiest access. A tourniquet is also placed to prevent bleeding. Finally, a sterile transparent drape is placed over the site. We use several modes of anesthesia. Systemic analgesia is addressed with an opiate drug. A local anesthetic is used to numb the surgery region. General anesthesia is by isoflurane gas at 2 to 3% for maintenance. And finally, a non-steroidal anti-inflammatory drug is used for several days after surgery, much like a human taking aspirin for pain and swelling. Trying to place it. So, we want it back. All Creatures is graciously letting us use their surgery suite to see.
Do you guys work together most of the time?
A lot of times, yeah. Yeah, we do.
Now, let me show you a bit of the anatomy involved here, using an X-ray image from a normal eagle's wing. A bird has 3 digits, the equivalent of your fingers, in each wing. One of these, the equivalent of a thumb, is movable and operates a flap called the alula. This is located on the leading edge of the outer wing. This flap prevents stalling during slow flight. The other 2 digits, called the major and minor digits, are fused and less flexible. These digits have 2 bones each, also known as phalanges. As you can see here, our girl has a displaced distal phalanx, like a dislocated fingertip in human terms. What could not be appreciated until examination was that the tissue was also dead. While missing a fingertip is an inconvenience to a person, for an eagle it means an inability to fly well enough to survive. There's nothing too elegant about amputating a dead wingtip, so I'm just going to show you the ugly details. First, dead tissue is cut away, down to and including the dead bone. Next, the live bone must be shortened so that the remaining soft tissue can be closed over it. I use a fine saw blade to accomplish this. Next comes some creative plastic surgery, as the remaining tissues are shaped to best cover the stump. I also had to remove a couple more feather follicles to free up skin to cover the site. As far as the amputation site, I'm going to sew the tendons together so there's some apposition to each other. So hopefully he can move the end of his wing semi-normally. Finally, skin is sutured over the site. As she's recovering from anesthesia, we apply a soft bandage for protection and comfort. A few hours later, the eagle is standing. Though drugs are still dulling her senses some, she is definitely aware of what is going on around her. As during her trip here, I have to wonder about how she mentally processes all of this. I can only hope that I am making her journey as comfortable as possible. Tomorrow she will move on to her next stop, West Sound Wildlife Shelter, where she will complete her recovery.